Hello, and thank you for watching Mount Carmel Health Partners Webinar of the Month. My name is Anita Obuji, Manager of Quality, and I will be your host for today's webinar on follow-up after emergency department visit for people with multiple high-risk chronic conditions. In order to receive the incentive for your time and attention, we ask that you watch this presentation in its entirety by December 29, 2022. And to also fill out the webinar attestation in W-9 and return it to Health Partners no later than December 29, 2022. If you have any questions throughout today's presentation, please feel free to contact Desiree Corbin or myself through our contact information listed at the end of this presentation. Before we jump into today's topic, I would like to introduce today's speaker, Dr. Daniel Windorf. Dr. Windorf is the President and Chief Medical Officer of Health Partners and a board-certified internist. He practiced as a primary care physician in Grove City for 25 years prior to joining Health Partners in 2009 and is an expert in alternative payment models, clinical integration, and population health. Let's welcome Dr. Windorf.
Thank you, Anita. It's a pleasure to be here to discuss this topic with all of you today. Today, we're going to discuss the new quality metric known as the follow-up after emergency department visit for people with multiple high-risk chronic conditions, which is quite a mouthful, so it is also designated by the initials FMC. This measure is meant to encourage close follow-up of chronically ill patients after an emergency department visit. It measures the percentage of your patients with multiple chronic conditions who receive a follow-up visit within 7 calendar days after an emergency department visit that did not result in an admission. The population measured are patients age 18 and over who have been diagnosed with at least 2 chronic conditions prior to their ED visit. The time period for this measure is essentially a calendar year. It is important to note that if your patient has more than one ED visit in an 8-day period, their first eligible ED visit is counted as the start of the 7-day follow-up period. The next slide lists the eligible chronic conditions. As previously stated, the patient must be diagnosed with 2 or more of the listed chronic conditions prior to their ED visit. So, if one of these diagnoses is made during the ED visit, it does not meet the metric. For instance, a patient with a previous diagnosis of only depression who receives a diagnosis of chronic kidney disease during the ED visit would not be part of this measure. Patients excluded from this measure would be those who receive hospice or palliative care during the measurement period. Also, patients whose ED visit resulted in an acute or non-acute hospital stay that day or within 7 days are excluded. So what meets the criteria? There are several ways to provide follow-up care after patient's ED visit. Listed on this slide are the different ways to meet the follow-up criteria. They include the outpatient telehealth or telephone visit, which will be more likely to be the one that you will follow, but there are several other visits that qualify as well. On the next slide, we have provided you with a list of some helpful CPT codes for some of these follow-up care visits. This quality measure is considered an administrative measure, which means it can only be closed via claims. With that in mind, it is important to make sure you are coding appropriately for the follow-up service provided. Your usual E&M code for an office visit will certainly be appropriate, but we have listed some additional codes you may want to use. As we all know, it can be difficult at times to perform follow-up care to patients in such a short time frame. We've listed here a few tips to help make you successful in providing follow-up care within 7 days of an ED visit. If you are interested in a further deep dive into FMC or any of the other quality metrics, please visit the Mount Carmel Health Partners website for previous webinars and other educational content. Thank you for joining us today for this review of the new quality metric, FMC.